Hi, my name is Quinton and I'm from Pain-Free Physio and Allied Health. I'm here to talk to you about carpal tunnel syndrome. Carpal tunnel syndrome is a painful and progressive disease that affects the wrist and involves compression of the median nerve. Now this affects about 2.7% of the general population and it affects women more than men. So what are the common symptoms of carpal tunnel syndrome? Now people often report pain, tingling, burning sensations into the hands, thumb and fingers, and this can also go into the arm and up to the shoulder. Now in some cases, people often report weakness and loss of coordination in the hands and fingers as they find it hard doing up buttons or they find that they're dropping things onto the ground. So what will most of the doctors say? A lot of the time, people with carpal tunnel syndrome are told to rest and avoid activities that may aggravate your symptoms. And they may also tell you to put some cold packs and keep it elevated if there is any swelling. And sometimes doctors prescribe wrist splints to restrict the movement that you have, especially when you're sleeping, because that can sometimes bring on some of your symptoms. However, this is only helpful in the short term. Once you take the splint off, the problems will come back again. And your doctor may also prescribe you some medications, such as anti-inflammatories, or they may give you corticosteroid injections. Now, if symptoms become worse, your doctor may suggest to go get a surgical release, and that can make up more space in your wrist or relieve pressure off the nerve. Now, some people can get immediate relief from your symptoms, but there are still chances that you might get some tingling, numbness, or even worsening of the symptoms. So what do we do differently here at Pain-Free Physio? Now at Pain-Free, we are experienced at using a holistic approach to fully assess and treat your symptoms. We look at your lifestyle, the activities you do at work and at home, and then we do a head-to-toe examination to identify any other causes or contributing factors that are causing your symptoms, and then hopefully prevent them in the future. In fact, there is actually a chance that the wrist may not be the cause of your symptoms. We have found that about 80% of the cases where people come in with carpal tunnel-like symptoms, the cause is actually not in the wrist, but it might be something from the shoulder, the neck, or even our chest. So, what does that mean? It means that if the sole focus is on the wrist, there's probably less than 20% chance of actually finding the problem. However, if we look at the whole body, there is more than 80% chance of finding the cause and treating it. At the end of the initial treatment, we will go through a treatment plan that outlines 3 main things. 1, what is the cause? 2, what treatment do you need? And 3, how many sessions or how many treatments will it take for you to achieve your goal? Now, if we use posture as an example, someone may have rounded shoulders or their neck is tilted to one side when they're working. In this case, what structures could it be that be causing your symptoms? Now, was this a habit or is it your workspace setup? So we're going to look at some examples and some strategies that are for an ideal work setup. So while using a keyboard, we want to keep our wrist straight, not bending up or down or bending to the sides. There should be enough space for your forearm to rest while not using the keyboard, and soft squishy wrist rests are not recommended. The mouse should be directly in front of your shoulder and close to the side of your body and level with the keyboard. The top of the screen should be directly in front of you and at eye level, and your seat should be adjusted so that the table is at elbow height. Your posture is also quite important. Make sure that you are not slouching forward, shoulders are back and relaxed, rather than having your arms outstretched. Now, these are all examples of strategies that can help if posture is the cause. If you are following the mainstream ways of treatment by a doctor or other physios, and you are not getting the results that you want, feel free to come and ask us any questions, and we'll be happy to explain to you what we do differently for carpal tunnel syndrome.